I don't like injections very much. In fact, I abhor them. Is it possible for me to have the hormone treatment via tablets?
There are two different types of hormone treatment. One is given by injections and the other is given by tablets. And you can choose which type of hormone treatment you prefer to have, and that's the same whether you take part in the Radicals trial or not. Now, in terms of trying to make that choice, the injections are widely regarded as the standard approach to hormone treatment. So we've got the most experience with the injections. We believe that the injections are probably slightly more effective than the tablets, but they do have a different side effect profile. So quite apart from the fact that it's not nice having an injection, and some men find that unpleasant, also with the injections you can pretty much guarantee that you'll lose your sexual function, at least while you're on the injections. Now, in contrast, the tablets, which we have somewhat less experience with and we think may not be quite as effective as the injections, on the other hand it is possible to retain normal sexual function whilst taking the tablets. Having said that, there is one additional side effect with the tablets that we don't tend to see with the injections, and that's breast swelling. And so if you take the tablets for any long period of time, especially more than 6 months, then breast swelling often becomes troublesome.
So can something be done to reduce the breast swelling?
Yes, so if you've got a preference for the hormone tablets rather than the hormone injections, and if you're allocated to receive 2 years of treatment, then we would suggest that you have some radiotherapy to the breasts at the outset. So if you have a single radiotherapy treatment to each breast when you start your hormone tablets, that can prevent the breast swelling that you might otherwise get later on. There's also another thing you can do. If you've been taking the hormone tablets for some months and breast swelling does develop, then you can take an additional tablet to try and deal with the breast swelling.
Oh, you can?
You can indeed.
Okay, so that would seem a good option.
If I'm having radiotherapy and hormone treatment together, how the hormone treatment will shrink the cancer, but it won't completely eradicate it. But so how will you know that it isn't just disguising the fact that radiotherapy isn't working for me? I'm not clear about that.
What you say is absolutely right. The hormone treatment will shrink the cancer but not get rid of it. And when you start the hormone treatment, your PSA will go down. And when you start the radiotherapy, it's very likely that your PSA will be undetectable already. And as you go through the radiotherapy, you're quite right, there's no way of knowing for sure whether it's working or not. So in order to find out whether the treatment has worked or not, what we need to do is to monitor your PSA over the years to come. And that's the same whether you take part in the trial or not. It's the same whether you have hormone therapy or not. In the years after radiotherapy, your PSA will need to be monitored at 6 monthly intervals initially and then annually. And if the treatment has worked, if you're cured, your PSA will remain undetectable.
If you decide not to go on to the trial, you won't, or let's say if you decide to go on to the trial, will the benefits be better? Will you be sort of more looked after in a better way, more monitored than if you don't go on the trial, or doesn't it make any difference?
So whether you choose to go in the trial or not, you'll receive exactly the same radiotherapy. So the radiotherapy is part and parcel of your standard treatment. That's what we think you need right now. Now, if you decide not to go into the trial, then you can choose whether or not you wish to have hormone therapy as well. And if you choose to have hormone therapy, then the hormone treatment will be precisely the same as you would get in the trial. The sort of monitoring that you would get on the trial is very similar to the sort of monitoring that you would get if you chose not to take part in the trial. There is some evidence that men who choose to take part in trials do better than those men who don't take part in trials. Whether that's because they get looked after better, we don't know. It may be that the sort of doctors that do clinical trials provide a better service than those doctors that don't offer trials.
Yes, if I was to join part of this trial, and in future my condition was to get worse, have I then lost the opportunity to have further hormone treatment or further treatment because I've joined the trial?
Absolutely not. So we very much hope that your treatment in the trial or outside of it will cure you. We very much hope you won't need to have any more treatment in the years to come. But supposing your cancer does come back in the years, your PSA starts to rise, then there are a range of treatment options open to you, and you're right that hormone treatment would probably be the first one to try, and that's exactly the same whether you take part in the trial or not. So the trial doesn't affect in any way your future treatment options.
Yeah, that's good.
This trial has presumably already started, and there are people already on it. I mean, how long do you see it going on for, and when did it start, and how long before you begin to get results that you can work from?
So the Radicals trial aims to recruit more than 3,000 men, and we hope that it'll recruit very quickly within a matter of a few years. But having finished recruitment, we then need to follow up those men for over 10 years. Because when prostate cancer goes bad after surgery, it typically takes 10 or even more years to do so. And so the treatments that we're testing, we will need to follow up men for that long in order to find out whether they do better with one treatment rather than another. So it is a long-term undertaking.
Yes, I see.
Will I have to have PSA tests for 10 years after going on this trial?
So once again, whether you take part in the trial or not, you will continue to be monitored in the same way. So typically, after surgery and after radiotherapy, you'll have your PSA checked every 6 months for maybe 5 years, and annually thereafter. And that's the same whether you decide to take part in the trial or not.
I understood that the follow-up for PSA was only 5 years, and that after a 5-year period you could be said to have been cured if all was successful.
So there's some truth in what you say. So if you get to 5 years out from treatment and your PSA remains undetectable, then it's highly likely that you are cured. But it's still not a guarantee. So there are some men who get to that 5-year point and all appears well, and later on the PSA starts to rise and the cancer comes back. And so we're really interested in the long-term outcomes of treatment, especially because we're interested not just in PSA levels and whether men are cured or not. What we're really trying to do is trying to minimise your risk of dying from prostate cancer. And it's very unlikely that you're going to die from prostate cancer in the next 5 or 10 years. If you are going to die from prostate cancer, it's much more likely to happen after that. And that's what we're trying to prevent.
Yes, I wonder if you can tell me whether there's any feedback after 5 years, or would we have to wait? Would somebody on the trial have to wait for 10 years before you had any feedback on the results of the trial?
So we have a data monitoring committee who do exactly what it says. They monitor the data on an annual basis. And they do that in order to make sure that the trial remains ethical and it remains an important comparison. So if at some stage the results of the trial become so clear-cut that it's apparent that one treatment's better than another, then at that stage the trial would halt and the results will be made public. Now, it's very unlikely to happen in this trial because we're comparing treatments that have already been widely used. And if one approach is better than another approach, the difference is likely to be very small. And it's likely to take 10, 15 years, possibly even longer, for that difference to emerge. When the results are known in 10 or 15 years' time, absolutely you'll be entitled to know what those results are. But it's very unlikely we'll get results sooner than that.